When we perform breast cancer surgery, we also need to remove some lymph nodes from your armpit. And that can sound a little worrying. So let me explain why it's important. The lymph nodes under your arm are like tiny filters. They help drain the fluid from the breast and catch any cancer cells that may try to travel. By checking these lymph nodes, we can see if the cancer has started to spread beyond the breast. As part of your investigations before surgery, you would have an ultrasound scan of the lymph nodes in the armpit. This helps to tell us whether there is any obvious spread of the breast cancer to these lymph nodes, which would then need removing as part of the operation. However, even if the ultrasound cannot show any obvious evidence of spread, sometimes there might be microscopic spread that we can't see in the scan. In this case, we need to remove just 1 or 2 sentinel nodes, the first layer of nodes that the cancer would reach. And if those are clear, no more nodes need to come out. But if there are cancer cells there, then we may need to remove more nodes in order to guide your treatment plan. This information helps us choose the best next steps, like chemotherapy, radiation therapy, or hormone therapy, and gives you the most accurate picture of your cancer stage. So, removing lymph nodes isn't just part of the surgery. It's a key step in making sure we treat your cancer in the most effective way. Research shows that in certain breast cancers, which have been detected early and have favorable features, we may not need to remove or even sample those lymph nodes. This can be in nodes that look normal on an ultrasound scan, or indeed when we perform a sentinel node operation and find only 1 or 2 lymph nodes with cancer cells in them. The SOUND trial looked at women with non-aggressive breast cancers and a normal ultrasound of the armpit nodes who were having a lumpectomy and radiotherapy. The researchers found that omitting the sentinel node surgery did not lead to worse cancer outcomes. The Z11 trial looked at women with small cancers, in whom the sentinel node surgery showed only 1 or 2 nodes with cancer cells in them. In this study, the researchers showed that not undergoing a full clearance of most of the armpit nodes did not result in an inferior cancer outcome at 10 years of follow-up. In simple terms, there is no one-size-fits-all approach in our practice. By paying attention to the research, we can offer bespoke treatment plans which avoid overtreatment.